Hello, everyone. Welcome to another episode of The Elemental Awakening. Today, I'm going to blow your mind with some interesting things I just got into about DNA and how knowing things about your DNA can impact your health on a whole new level. So stay tuned for this amazing interview. Dr. Winnie, I want to welcome you to the show. Thank you for being here. And I'm really excited to talk to you today about DNA testing and all these amazing things that you do.
Yeah, thank you for having me, Giovanni.
Awesome. So just as a little background, a few months ago, I was embarking on a health journey. I'm trying to improve my HRV and just really get some insights into how I can become just healthier and optimize my health. And along the way, one of the things that was recommended to me was to do a DNA test. And not a DNA test like you might be thinking, like Ancestry, to find out my lineage, more basically on how my DNA functions. And Dr. Winnie's going to go a little bit deeper into it. But when I did the consult, it was so fascinating. And I shared a little bit of it on some of my social media. People were asking me, like, how do I find out more? So I said, you know what, let me just invite Dr. Winnie on for a call. And we can explore all these questions and more. So I guess, welcome, first of all. Thank you for taking the time to be here. And tell me a bit about, a little bit of the backstory, how you got into this and, how you're using it today to sort of help people take their health to the next level.
Yeah. So my training is a naturopathic doctor. And one of the big areas, we talk about gut health and detoxification. And detoxification is a big passion of mine. And that's what actually launched me into looking at functional genomics and the use of the detoxification genes to get a better idea of someone's ability to detoxify. Because you can't just run a lab test to look at your liver enzymes to get an idea of your detoxification ability, because only liver enzymes will be elevated if you're having any major issues like fatty liver or some type of liver disease. But what piqued my interest was, okay, how well do I detoxify my body? And through meeting Dr. Mansoor Mohammed, the clinical genomicist, founder of the functional genomics at the DNA company, I learned a number of different genes where it goes into more detail about explaining my body's ability to detoxify, phase 1, phase 2, etc. So that really was what launched me into functional genomics. But since then, I've been working with Dr. Mansoor Mohammed for about 6 years now, in practice for 7 years. And it's just very fascinating in terms of what else we can learn besides detoxification. For example, mental health, right? How our body processes stress. Are we more prone to, low mood, or are we better multitaskers? So there's just so much there from a mood and behavioral perspective. And then there's a lot of different areas as well that we can learn from genetic testing.
So when on our call, I think some of the things that we went over was, like how my body metabolizes stress hormones. We talked about how, like something I had no idea was, I had some predisposition to inflammatory and cardiovascular sort of issues. And, you recommend some very specific vitamins or supplements I should take that would help with that. So, I guess my question is, before DNA testing, I guess a lot of these things would be done through like a blood test maybe, but, try to give a comparison of like how specific you can get on like a DNA test versus a blood test and sort of the things you can find out and maybe some of the results you've seen by identifying some of these things. If you have any examples, I'd love to explore them. Yeah.
Yeah. So going back to what you were saying before, where, functional genomic testing, what you did, the test that you did is very different than the conventional way of testing genes. So the conventional way of testing genes is to say, oh, if you have this gene mutation, you have this disease. But that's not what we're looking at in functional genomics. We know that our body runs on a certain way of biochemistry, right? And the genes that are tested through the DNA company is these genes are coding for proteins, enzymes, receptors, and depending on each individual's gene results, we can get a better idea of their personalized biochemistry. So that's one type of insight that you can't get necessarily on blood testing, because blood testing is in a way a conventional way, and it is useful, but it's more of, the after response of maybe certain changes for a long period of time that's happening in the body. So let's just say, for example, we'll take vitamin B12. I'm sure a lot of your listeners, yourself, are familiar with vitamin B12. Now, in a blood test, we can see, oh, okay, someone is low or they're medium or they're supplementing, it's elevated. But a lot of times people may not necessarily check vitamin B12. Now, in a functional genomics test through methylation, which is a process that requires B12 and other B vitamins to keep down inflammation, there's a specific gene that's looked at called FUT2. Now, this gene codes for an enzyme that binds to B12 when we're getting B12 through our diet. And depending on someone's gene result for this FUT2 gene, we can know off the bat, oh, there's someone that has a less optimal or less efficient form of absorbing this dietary B12. So this individual is going to be more susceptible to B12 deficiency. And then if someone chooses to be more plant-based, be vegan, vegetarian as a lifestyle option, and they have the suboptimal FUT2 gene and suboptimal enzyme, therefore they're going to be at that higher risk of B12 deficiency. And we all know kind of the importance of B12 from an energy perspective, from preventing anemia, et cetera, et cetera. So we really don't want to be deficient in vitamin B12. In a similar way, vitamin D. If you do a blood test for vitamin D, it can show if you're low or high, but through functional genomic testing, we can see perhaps if you're at increased risk of vitamin D deficiency based on how well you activate vitamin D from sun exposure to your skin, or how well your transporter of vitamin D is in terms of delivering that active vitamin D to the cell. So here are some, comparables of vitamins, right? Certain nutrients that we can look in a blood test versus functional genomics.
Yeah, so blood test is more of like a snapshot of like what's happening. So for me, like you just pretty much nailed two of the things that sort of were eye openers for me, because I've been a vegetarian for I think 11 years now. And, like always telling you to, take B12 supplements. I think even like people who are not vegetarian, but don't eat good quality, I guess, meats will also need to supplement as well. There's a really interesting documentary that came out not too long ago, Game Changers, and they started really break that down. A lot of controversy around it as well. But what I found interesting was, that the FUT2 or FU2, the one you just mentioned.
Yeah, FUT2 gene.
That was something that I had an issue with. And, I need to take B9 to help support the methylation of B12. So, here I am, saying, okay, like I'm supplementing B12, but it still might not have been enough because, vegetarian, plus I have this sort of DNA, the way my DNA is doesn't support it fully. Yeah. And the same thing I found with vitamin D. Like I love going out in the sun. I love being out there. And also, that was another one that I sort of had to sort of supplement as well, just to make sure that I had enough. And one of the things I had in my notes from our call was that a B12 deficiency may lead to anxiety. So, that's like an eye opener, because nowadays, it's like everyone is saying like, I have anxiety. And, obviously there's a lot of stressors that sort of, that can add that are in your environment, but also I guess from a vitamin and mineral perspective, if you're not helping yourself on the other side too, you might be like compounding the issue. So I guess my question is, are people like, I guess, is the stress adding to sort of the deficiency and like, knowing, like how do these things sort of correlate with each other? Yeah,
for sure. So, I mean, if someone has a suboptimal gene for the coding of these enzymes, and that enzyme itself is not going to be great at let's say for B2, it's absorbing, or vitamin D, which is, transporting. But then we kind of have to think of, if there's increased stress, there's more demand on our body to have the energy, let's say, right? But energy, we have to look at maybe the biochemical level. So oftentimes we hear about magnesium deficiency with higher stress, but B vitamins are also super important, in terms of when there's this higher stress level, B vitamins will also be utilized quite a bit. So if you're deficient and you're not necessarily supplementing, then you're going to really fall into that deficiency state. Something I think, Giovanni, I mentioned to you, where from a clinical perspective, my colleagues and I have seen, many vegans, vegetarians over, years, not it's not usually when they first start, but years of being vegan or vegetarian and not necessarily supplementing with B12, they may have high levels of anxiety as a result of the deficiency. Now, also when it comes to B12, B9, B vitamins, there's a lot of available forms of these B vitamins out there at the health food store, online, however you purchase, these supplements. And based on the functional genomics, looking at the pathway of how B12 is utilized, how B9 is utilized, we're able to get an idea, for Giovanni versus for Winnie, what are the preferred forms of B12 and B9 that's more suitable for someone. Some of your listeners may have taken like a like just kind of bought a B complex, heard it's good for energy, taking it, and then all of a sudden they feel more tired or more brain fog, or any existing symptoms they have are aggravated. One of the things to consider is that if someone has suboptimal methylation and maybe taking the not the preferred forms of these B vitamins for them, or taking too much at one point, it could cause this, type of over-methylation. And this is something that Dr. Mansoor Mohammed once again brought our attention to, and then just through seeing more patients, it's a pattern that we see. So, for your listeners, super important to know maybe what the preferred form of these B vitamins are for them.
So can you give me some examples of forms? Like I know like magnesium, there's a magnesium oxide and magnesium thronate and magnesium, like there's like 5 or 6. Can you give me a little bit on the different forms of like, I guess every vitamin has a different sort of.
Yeah. So the active form of vitamin B12 is called methylcobalamin. A lot of times kind of the thinking is that the more active a compound is, the better absorbed it is. So across the board, a lot more supplement companies are using, methylcobalamin. The other forms of B12 are called adenosylcobalamin, hydroxycobalamin, cyanocobalamin. So those are the other alternative forms usually. And then for vitamin B9, folate, the active form is methylfolate. And this is, once again, the same kind of thing with vitamin B12, the active form. It's more widely available. But there are other forms of vitamin B9 called folinic acid, folic acid.
And depending on your DNA makeup may interact better with your system to absorb more optimally or utilize other things more optimally.
Yeah.
Interesting. Okay, so one thing I hear a lot about is like inflammation. Sorry, before we go back, just want to roll back one question. So do we know like why B12 deficiency makes you feel this anxiety? Is the system overworking? Is there any sort of insight, or we still haven't figured that out yet, why that may lead to anxiety? Or do you have any insights on what you think?
Not at this point from my perspective, but when the body is deficient, right, it's going to have a kind of signal to us to do something, right? And that's why when we feel sick or when there's a symptom, usually we should take some action. But clinically, it's just a thing that we've seen very, very commonly. And a lot of times, if we are working with our vegan and vegetarian patients that have a high level of anxiety, the first thing we'd actually do would be doing B12 injections for a period of time to really help build them up, and then switch to an oral supplement. And
you usually see like a really quick and immediate like difference in a lot of people. Wow, interesting.
Yeah.
I haven't taken a B12 injection. Not that I really have anxiety. I feel like at night, like my mind is overactive, and I'm just trying to figure it out because my HRV values during the day are pretty good. And then when I go to sleep, they drop, which is the opposite of what they usually say. Usually they're lower during the day and higher at night. So I'm just trying to crack that code. That's why I'm doing all of these things here. So I'm not sure what it is. So I have a lot of, I guess, ideas what it could be, but there's a lot of these things we're just learning about now, like collectively. So it's quite interesting to me. So inflammation, I know everyone's talking about inflammation these days. So what can DNA testing tell us about levels of inflammation, and how can it help? And what's your take on like inflammation, how to manage it? I know it's a pretty broad question, but just curious.
Well, in terms of inflammation, there's two different types of inflammation. There's the acute inflammation, and then there's chronic inflammation. So acute inflammation, in a way, is valuable because it signals to our body, our immune system, to come, heal, repair the tissue.
Hmm.
Um, Whereas when this acute inflammation is not addressed completely by the immune system, it takes a chronic nature, right? And this is what we don't want, because it will start creating more damage to the cells, the tissues. When it comes to looking at functional genomics, one area that's related to chronic inflammation is methylation. So if someone has suboptimal methylation, yes, you can do things to help support it from a supplement, lifestyle, dietary, etc. perspective. Um, but it's good to know what your underlying, methylation is, because if you know, oh, it's not great, then you maybe want to take a more proactive stance in reducing things that can, cause inflammation. Um, as well, I've worked with quite a few athletes too, in terms of understanding their methylation, because yes, exercise is a good thing. It creates a level of stress on the body and inflammation. And if someone is suboptimal at methylation and constantly, pushing their body in terms of training and not allowing that recovery time, they're going to be more prone to injuries. So I think that balance of understanding your body's ability to handle, inflammation and its chronic nature is something, very, very valuable. Now, inflammation is this very broad thing, right?
Yes.
Now, some people experience inflammation in their joints, in their muscles, but another area is neuroinflammation. Have you heard of this term before,
No.
Giovanni? No? Okay, so neuroinflammation means that the nervous system and the brain is, can be inflamed, right? And there's a number of different things that can potentially, do that. And as a response, it could affect our mood, like it could lead to depression, anxiety, brain fog, are all aspects of neuroinflammation. So for each individual, depending on where their susceptibility is it more in the muscle, in the joints, or where in their body, or is it more geared towards brain health and cognitive function? Now, when it comes to functional genomics, methylation is one part of it in terms of looking at inflammation, but the other piece we like to tie together is the body's ability to detoxify, right? Because we are exposed to a number of different toxicants in our environment, or even internally produced by the microbes in our body, that can lead to inflammation. So if we're not detoxifying well and we have poor methylation, then there's a lot more work that we need to do. Whereas if we have, good detox, suboptimal methylation, they want to support the methylation, and vice versa, then we want to support detoxification.
Interesting.
And then in terms of how would we address kind of inflammation, is definitely working at those areas. And if there's any type of acute or chronic inflammation, there are a number of different, nutraceuticals, herbs, vitamins that can help with inflammation as well.
So, okay, so there's a two-pronged approach, which would be methylation and detoxification, depending on what shows up in your DNA.
Mm-hmm.
Okay, that makes
And
sense.
actually, I didn't mention this, and you kind of spoke about this regarding your results in terms of cardiovascular health, right? When our blood vessels are more susceptible to inflammation, and there's specifically a gene that's looked at in terms of, is someone's blood vessel more susceptible to inflammation? If it is, then we may want to screen for family history of heart disease, personal history of heart disease, and then ask, is that one system that we need to support this individual on because of, these susceptibilities? So it's kind of
Interesting.
like doing the genetic testing to look at blind spots, right?
Mhm.
Or reveal kind of weak foundational areas in our body, and then taking that proactive approach. That's kind of your approach. Whereas some patients that I see, they do this genetic testing because they've gone to so many doctors.
Can't figure it
That
out.
can't figure it out. So going to the gene level and looking at the functional genomics can give some insights to say, oh, connecting this and this and this, that's, most likely what's happening. What can we do about it now?
Interesting.
Mhm.
Um, so just going back a bit to one question about neuroinflammation, are there specific symptoms that someone could tell if they have inflamed nervous system? Like, is there anything that would really stand out that would be a marker like, hey, you have neural inflammation? Just curious personally.
Yeah. So a lot of times, like brain fog. I know it's kind of subjective, but if there's some level of brain fog, there's probably some level of neuroinflammation. I went to a conference in Arizona, a few years ago, on environmental medicine because I've received additional training in this area, and the conference topic for the whole weekend was on neuroinflammation. So you have researchers, clinicians, functional medical doctors, naturopaths talking about this specific topic and then how it shows up, right? So how it shows up potentially can be mood related, anxiety related. There's so many aspects to like if you even do a Google search of neuroinflammation, you would see potentially the different ways that it shows up symptomatic wise.
Interesting.
Mhm.
Cool.
Mhm.
Another question I had is when people start looking at both, methylation and detoxification, have you seen like anything like food sensitivities or allergies change in people? Because sometimes that's what people say cause inflammation. Is there any
Mhm.
correlation to what you do and how people respond to eating different foods and how inflammation sort of shows up?
Mhm. So the functional genomic test through the DNA company doesn't test for food sensitivities because that's a blood test. And in that
Mhm.
blood test, it's looking at the immune system's response to some of these foods, and it's particular, let's say the proteins. So let's say wheat and dairy, the proteins, gliadin and casein, is that causing an inflammatory response in the body? So that would be more like food sensitivity based testing. Whereas through the DNA company, we can see, okay, let's say if someone's intestinal lining is more susceptible to inflammation, right, as well, they have suboptimal methylation, then those are definitely signs to say, hey, for me to ask, hey, do you have any food sensitivities? If you do,
Okay, I
you know,
guess my question was a little bit in reverse then. So,
okay.
have you, is it possible that because someone may have poor detoxification and poor methylation, if they improve those, would their food sensitivities change because now they're able to sort of process maybe some of these things that they just weren't processing properly
Mhm.
before? And I
Yeah,
don't know if that's a common
that's a
question.
good,
That
yeah,
makes sense.
yeah, no, 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 for sure. And when it comes, let me backtrack for one sec. When it comes to food sensitivities, I've had patients that have done these tests, and let's say that 200 food sensitivity tests, right? 200
Hmm.
foods that they're testing, and then the results come back, and they're like, "Oh my gosh, 100 of these I'm being reactive to. Now I can't eat anything," and then it becomes more stressful, right? But through my years of practice and just seeing patterns, there are certain foods that can heighten the body's immune system reactivity. And if by even reducing those, then the reactivity of those other foods come down. So in a similar way, if you're um, avoiding foods that are triggering this inflammatory response, and then you support your suboptimal methylation or suboptimal detox, you're bringing down things that can heighten that inflammatory response in the body. So yes, that would actually be a really great idea if someone knew that they had food sensitivities to avoid, because of the immune system's you know being hyperactive.
Hmm.
Mhm.
Awesome. Um, so another question I have is like, can DNA change over time? Like, can your results, if I took a test now and I did a bunch of changes in my life, would I see something different in the future?
Mhm.
Is that how does
Yeah,
that?
good question. So with the DNA testing, because their genes that are inherited from your parents. It doesn't matter, Giovanni, if you tested those genes now, if you tested them 20 years in the future or 10 years, historically, those genes won't change in terms of your genotype for that gene. However, when we talk about, well, what can be done, right, from a preventative standpoint, there's the term epigenetics, right, where this is important because you can have that influence in that positive direction. Because once again, functional genomics is more of helping one understand their body better. It's not a, oh, you have this gene mutation, therefore you're going to have this disease.
Mm-hmm.
Whereas if someone did that type of testing through conventional medicine, let's say they're testing for cystic fibrosis, right? If they have that gene mutation, then they have that disease. Whereas with functional genomics, it's not a predestined thing. It's just saying, hey, here are your weak spots. Here are the areas that you want to work on. So epigenetics, through lifestyle, through diet, through supplements, through food as medicine, are all factors that can help support the weaker foundational areas.
So the actual DNA doesn't change, but can perform differently based on the environment? Is that a way to sum it up?
Yeah. So the DNA codes, so the genotype, or the coding of the DNA is giving instructions, right?
Okay.
It's like a manual.
Okay.
To produce the byproduct, which is a protein. It can be an enzyme protein or receptor protein. So that version of that enzyme receptor will always be as such, but you could support that enzyme. So a really cool thing, for example, and this is kind of new information, there's a detox enzyme called glutathione S transferase. It's part of phase 2 detoxification. And through sulforaphane, so sulforaphane is a compound that's found in cruciferous vegetables, broccoli sprouts, cabbage. So sulforaphane can help increase the efficiency of this enzyme. So if you had the less efficient form of this enzyme, okay, through your diet, by eating certain foods or supplementing through sulforaphane, would help out that enzyme, right? So that's kind of the gene coding itself won't change though.
Interesting.
Yeah.
Okay.
Yeah.
Cool.
Or else you're going to be a mutant, right? If someone gives you something to change your actual DNA in that way.
I'm going for Wolverine if I have to mutate. Okay. Okay. So just getting more clarity on this DNA, sort of trying to explain it in more layman's terms. I hear the term junk DNA a lot. I'm just curious what your perspective is. I don't think anything is junk. I think within the body, it probably has some role. Maybe we're not activating it yet. Maybe that's going to give us these mutant powers one day that once these turn online. Do you have any perspective, like personal perspective, on what the role of junk DNA is? All these things that we just don't know what it does?
Yeah. So I actually asked that question to Dr. Mansour Mohammed. Like, he's my mentor in this area of functional genomics, right? Because he's going through, like I go through research related to implementation of clinical practice of information, whereas Dr. Mansour is looking through genetics. Like he was a conventional genomicist and then started working on functional genomics because he saw that we could play a bigger role in helping people. So he's my mentor, and so I asked him that same question not that long ago, maybe like 8 months ago, before COVID. And so he's like, yeah, well, with that term junk DNA, it's not actually junk DNA, because more and more research is showing how the information in those areas of the DNA, it communicates to other parts of our DNA. So it's a communication. And kind of back to your point, it has a purpose. Maybe we haven't figured out that complete purpose of that DNA, but we can't disregard it, because the same way as how we look at nature or science, it's like, oh, if we don't understand we can't just say, okay, like that's not true, that doesn't work. It's like, okay, how can we understand it, right?
Yeah.
And so he's like, it's pretty incredible in terms of the junk DNA. And he said there's another term for it now, but I can't recall what it is.
Yeah, I would
Um,
I would think that you should call it maybe like mysterious DNA or something that was like it sounds like a very egotistical scientist couldn't figure it out and said, well, this is all junk, so it doesn't do anything because this is all that matters. It seems that's how I'm envisioning the
yeah,
saying that. So, uh,
exactly. But yeah, the DNA will like from certain areas, say there, will communicate to help with making of the proteins or the enzymes from this section. So there's like this interconnected communication between our DNA that maybe we are not at that level of understanding why that is or why it's needed. Um,
interesting,
mhm.
interesting. So I guess next question would be like, what do you think the future of DNA testing and using this as a tool to be healthier, to perform better? I know that this whole sort of category or space is evolving pretty quickly.
Mhm.
Like what do you think is on the horizon, or what's already on the horizon, and what do you think the potential of it 5, 10, 20 years from now? Like, are we
Mhm.
thinking like curing cancer, all disease? Like, what's your perspective on
Mhm.
near term and far term?
Mhm. Yeah, so what I see currently is that more individuals are looking for, personalized medicine, right? And that just makes sense.
Hmm.
And so with the research that's going on in terms of functional genes, and Dr. Mansour is doing a lot of this, but understanding functional genes more and more and adding more genes to be tested will give a better and better idea of some of these things that we talked about and kind of the connections of the body in terms of when someone has more information and understanding of themselves, it allows them to be more proactive and preventative in terms of health issues or concerns. um, I think that when it comes to performance, right, the more information we have, the better performance we can be. One of the really important areas is understanding our minds, right? And by um, kind of seeing, oh, it's a physiological response, or this is how my neurotransmitters are. It's not to say I'm kind of in this state solely, but it helps with understanding our mind to help improve, performance. I think that's a really, really big piece. There's so much stuff that's being done in the area of genomics when it comes to, healthcare. I think there's so much more that can be done, and I think it has to do with just more research and potentially in the future creating more studies where individuals who go into the study have similar genes,
Hmm.
and then seeing what the clinical effect and outcome is. I think it will help really streamline treatments a lot better instead of kind of, okay, we're looking for 100 subjects for, let's say, a study, and everyone who, no, without looking at genes. I think looking at genes can really help with creating more clinical treatments for people.
Interesting.
Mm-hmm.
Thank you. Um, I guess last question, or coming to the end. I guess I got a couple more questions
Yeah.
actually. Um, what about like DNA damage? I've heard some of these things, maybe from like EMF or Wi-Fi, or different maybe like heavy metals. Is that something that is like what does that mean exactly? Is that a true thing? Is it how would that affect someone? And is there
Mm-hmm.
anything you can do about it?
Yeah. So um, I think one of the things we may have talked about in your genetic testing review, the genomic review, is something called oxidative stress and mitochondrial function. So when it comes to heavy metals or toxins, they affect the mitochondria. And then there's also more oxidative stress. And so the reality is that if we are able to minimize these things, and not for me to say let's all live in a bubble, because that's not reality, but whatever we can do to minimize these exposures, I think the better it is for our health, because some of these things we don't see an immediate symptom, right? It's not like, oh, we have a flu, we have a fever, we don't feel so great. Some of these things takes years and years before we see some type of impact on our health. So anything that we can do to once again be proactive in minimizing EMF exposures, minimizing these different types of toxins in our environment from our food, our water, air. I
Can these
think,
things like alter our genes in any way or damage them, or it's just going to impact their functionality? And I don't know if I'm asking the
yeah.
question,
So
even the question
yeah,
makes sense.
yeah. So it's not necessarily, well, it potentially could be immediate, right? And then years before someone manifests like a health issue from it, but then it's generational as well. So that's one thing that's been really interesting. And more research needs to be done on it. But in terms of how DNA can be modified based on the environment, right, and then being passed down to the next generations to come. So I think that's something we always have to keep in our mind. And there is research looking at these types of impacts from toxins.
Awesome. What's the difference between, is RNA and DNA related?
Yeah, so they're both part of genetics, but DNA is what we're looking at in terms of looking at these genotypes and the testing through the DNA company.
And then RNA, what would that be? Is that
Mm-hmm.
something totally different?
Yeah, so our RNA is ribonucleic acid. So it's part of the mechanisms of DNA, but a little bit different. Yeah.
Okay, so I'm gonna throw one more question out here. If you don't know the answer or don't want to answer, that's okay. I just heard rumors of some of these new COVID vaccines are gonna have something to do with like RNA and affecting DNA. Like Moderna, like in their name is RNA, and there's been a lot of like questions about that. Is there any sort of thing that you would think could be an issue with that, or are you not versed on that topic? And if you're not, that's okay too.
Mm-hmm. Yeah, I'm definitely not versed on that topic, but super important for people to look further into if there are components in vaccines that have that, because of course that's a signal to DNA changes, right? Um, we know that with certain vaccines in the past, there's been adjuvants to help stimulate the immune response to get a better antibody production, let's say. So I'm not exactly sure with this specific vaccine, if it's in there or what the purpose is. But
Mhm.
if you or your community has heard of that, then it's definitely a really good idea to do some further research in it. And I will definitely myself as
Okay,
well.
cool. Yeah, I'd
Yeah.
love to hear
I'm going to
back
get
then.
back to you on that one.
Okay. Okay, thank you. Okay, last question. Some people are a little bit hesitant about giving their DNA to a company. They're scared they're going to sell it. They might do stuff with it. Especially with these ancestry, are they collecting a database to then do something with it or sell it to a company?
Mhm.
I guess you might get this question time to time. What's your take on that? And also like the way your company, keeps people's information safe
Yeah.
from that perspective.
Yeah. So, in terms of when the when the sample is collected, the sample is collected in a test tube, right? You recall that test
Hmm.
tube, and that test tube has a barcode, so it's anonymous already. So no information about the individual's name is attached to that barcode at all. So the lab does not know who this individual is, etc. Through the DNA company, there is a specific document if people would like, in terms of the confidentiality, the privacy. There's a document there just to list out, because the DNA company has had inquiries, just kind of what you said. Lots of people are curious, how does the company keep the information safe, um, you know etc. So there's actually a document on that for individuals, your listeners who are interested in maybe doing DNA testing through the DNA company. They can also ask for that document.
So is there anything that companies could do that would be that you wouldn't want them to do with your DNA? Like, like is there uh justifiable fear in like someone having access to your DNA? Like what would, like, I'm not sure, like I see like from a confidential and private, I just would probably prefer like none of my information any companies have. But is
Mhm.
there something to be like fearful of that they could do with it? Or is there anything that comes to mind? Or these are just things that we're making up in our mind, trying to think like, oh, if they have my DNA, then they can make me sick, or they can do
Yeah.
something or create something specifically for me that I'm going to get addicted to, or I don't know.
Hmm. Yeah, not that I can think
Think
of
of,
at this,
okay,
yeah, at this moment. I think it's just more of, confidential
confidentiality.
information remaining confidential, right? I think maybe perhaps sometimes if, um, you know, and it's more so related, we have to kind of go back to how this maybe fear came about when it comes to conventional genetic testing for certain health um, conditions, right? If someone from an insurance standpoint, right, is um, like the insurance company requires this information and they've done a genetic test, but from the conventional medicine standpoint, oh, they have this disease and now they'd have to disclose it.
Uh-huh.
Um, but functional genomics is not like that because it's not saying that, oh, you know, Winnie or so and so has this health condition. So I think that's where the fear may have come from. But of course, I think going back to having a company having information about ourselves and that just remaining confidential.
Mm,
Yeah.
gotcha. Awesome.
Mhm.
Thank you.
Yeah.
Okay, so I guess last question. You know, how can people get a hold of you? Do you have a website or a social media account? Or if someone wants to, get a DNA test done, like what would you recommend and how can they sort of get
Yeah.
connected?
Yeah, for sure. So, if they'd like to do, DNA testing through the DNA company, then they can be found at the DNA company website, mydnacompany.com.
Okay.
Okay. And through there, they can find and access DNA testing. And I do genomic consultations as well as, creating treatment plans, custom treatment plans for patients through the DNA company. As well, I have my own private practice called Enviromed Clinic. So that's enviromedclinic.com, where I see patients as well. So those are two different ways of finding me. I'm not big on social media right now. I have too much going on with patients. So
Which is
I'm
good. It's
I'm
a good
not I'm
sign.
not yeah I'm not live on social media, but I just focus on clinical practice.
Awesome, awesome. And so the people that typically would find this useful, it can be someone who's looking to heal or someone who's looking to optimize performance, right? So it doesn't matter where you're at, you can really gain some insights and changes
Yeah.
in your overall health by doing
Yeah,
this.
exactly. And I think it's just, if someone wants to and is curious about getting more information about their body and understanding their body, it's a great GPS or mapping of these different areas. So whether someone wants to optimize their health or whether they're, just wanting those insights, I think, variety of people will kind of look at DNA testing.
Yes, and I think like it really resonates with me because I think the functional medicine model is let's get to the root and let's fix things from the inside out rather than, let's put a band-aid on things. And I just really hope, well, I think one way or another, people are going to move in that direction as they start losing faith in the old system, which has pros and cons. So what they do, there's some things they do really well, and there's some things that I think are really outdated.
Hmm.
So hopefully one day we use the best of both sides so that we have the best system possible. So I
Yeah.
just want to say thank you for all the work that you do and for sharing all the things that you've shared. I'm sure many people are going to find this very useful. Please, guys, check out Dr. Winnie's website. Check out the DNA company. And if you have any questions, connect with me, and I can point you also in the right direction. So just in closing, anything you want to sort of add there, just to close off?
No, like thanks so much, Giovanni, for inviting me to this interview. I'm glad to have shared this information. If you have any other questions, feel free to reach out to me as well to clarify anything. Um, yeah, I had a really fun time.
Awesome. Yeah. Thank you so much. Okay.
Okay. All
All right,
right.
guys. Thanks for watching. We'll see you soon and love you guys. Peace.